Okay, you're good.
Medic 2, you are needed for a one-vehicle multi-vehicle collision. 23-year-old patient is awake and breathing.
So, discuss information?
Yep.
Alright, so PPE. Is my scene safe?
Yes.
Fire or anybody else en route?
Does not say.
Okay. So my scene is safe.
Yep.
Mechanism of injury I'm going to be is a car accident.
Yes. Head-on motor vehicle collision.
Number of patients?
Just one.
Just one? Yeah. I don't know who it hit. So at this point, it's always better safe than sorry to call ALS, and then you can cancel if needed. So I probably don't need additional help, but I might call them just in case at this point with very little information. And then consider C-spine. Is she up and walking? Does it say that?
It just says awake and breathing.
Okay, so we'll probably consider C-spine at this moment because there wasn't a lot of information.
Yep.
General impression, a female, right? We'll say female. Who is alert and breathing after a car accident. And why? Chief complaint?
Chief complaint is chest pain and difficulty breathing.
Okay. And then level of consciousness.
Level of consciousness. What's that?
I'm asking my bear if it's conscious.
Oh.
Is my bear conscious?
Yep, alert.
Alright. So then I feel like I'm missing something. 1, 5. Okay, so we'll go to airway. My patient is breathing. Right? No, nothing in the way of that. So then we don't need an adjunct. So if I assess breathing, what is their rate or number?
Rapid and shallow.
Is it adequate?
Just, it's equal.
Okay.
Equal chest rise.
What is their SpO2?
88.
Alright, so at this point, we're definitely going to need to apply some oxygen. I think it'd probably be best at this point to go with a non-rebreather at 15 liters. So that's what we're doing. We're applying that. Assess breathing. Adequate ventilation. Oxygen therapy. Is there any injuries that can compromise the airway?
It does not mention any.
Okay, so I'm going to assume not. Circulation. Pulse. What is my patient's pulse?
Strong, regular, slightly rapid.
Does it have a number? How many beats a minute?
Not there. Give me a minute.
It's on the second page usually.
Okay, let's see here. 124.
Jesus Lord. Skin. One pink dry.
Pale, cool, bit sweaty.
Okay. Is there any major bleeding?
No significant bleeding.
Okay, so then at this point we would initiate shock therapy because of the vital signs and skin. So we've already got oxygen on. We're already in the supine position, so we're going to cover the blanket, but we really can't do that. We're going to go as a priority, and if we have to, we can meet ALS. So we'll do history on the way. So vital signs. Pupils. I'm assuming pearl.
Yep, Pearl.
Okay, we'll do a blood pressure on my lovely bear, which this is not going to work whatsoever, but you know. Doing a blood pressure on my bear.
140 over 86.
140?
Yep, 140 over 86.
Okay. Respirations, yes. What are the respirations again?
Respiration is 28 and shallow.
And then sample. S. Signs and symptoms, I'm assuming, is the labored breathing, chest pain.
Okay, what was that?
Signs and symptoms. We're in sample.
Signs and symptoms. Okay, yep. Signs and symptoms is. Come on, where are you hiding from me? It doesn't even have an S on this one.
Okay, so S.A. allergies.
No allergies.
S.A. medications.
None.
S.A.M.P. Pertinent medical information.
Appendix removed at age 11.
So that's pertinent. S.A.M.P.L. Last oral intake.
Pizza at 7 p.m.
And then events leading up for E.
Driving home from a friend's house.
And then we're going to go to the head. So we'll palpating the head, and the ears, I guess. Is there any contusions, abrasions?
Nope. None noted.
We'll assess the eyes. I'm assuming nothing because they're pearl. There's no bleeding or anything like that.
Nope.
There's nothing, no blood or cerebral spinal fluid from the ears.
Nope.
Or mouth.
Nope.
Nothing, no abrasions or anything on the face.
None.
Head, neck. JVD.
None noted.
Cervical spine.
Slight cervical pain in the back of the neck.
Okay, palpating that, by the way. Need to note that.
Yep.
Trachea position. I'm assuming it's
midline.
Normal. Okay. Head, neck, chest. Palpating the chest. Any contusions, abrasions?
Tender to palpation.
Palpating. Any notable bleeding?
Nope.
Okay, we're gonna do some lung sounds.
Diminished with crackles in the bases bilaterally.
Oh, okay, that's a little rough. Sorry, dude. Abdomen, palpating, feeling, is it tender, extended, hard, soft?
Soft and non-tender.
Pelvis, is it stable? Palpating that.
None noted.
Okay, is the perineum thing, which I mean, doesn't really matter because it's female, but is that present? I'm assuming not.
Nope. None noted.
Okay, upper extremity, no, lower extremities. Lower extremities, so any contusions, abrasions, bruising.
Bruising and tenderness to both knees.
PMS.
Doesn't say anything about PMS.
Okay, so I'm going to assume it's there then. Do both legs, so same with arms, bruising, tenderness, PMS, any abrasions?
Abrasions and tenderness to left shoulder.
Okay. So we would want to probably take care of that, make sure that's all good. We're going to roll them and check the posterior. I'm palpating the back, and am I noting any abrasions or tenderness or anything back here?
None noted.
Secondary injuries? Anything noted? Any minor abrasions or bruising or pain or anything?
Assessment. All that it says is increased work of breathing noted, but no secondary. Oh, yep, no secondary injuries really.
Okay, and then at this point, you would reassess the patient probably every 5 minutes, and you would definitely want to keep an eye on this breathing if you haven't met ALS yet, and manage pain if possible. You keep track, make sure those injuries are alright, keep track therapy, things like that.